It's Tuesday, October 15th, and this is the Daily Medical News, where we bring you clinical medicine's top headlines as well as a closer look at the day's biggest story. I'm Molly Collegio.
And I'm Nick Andrews. Today, wasteful healthcare spending could reach nearly $1 trillion.
Short-term statin use may increase the risk of skin and soft tissue infections.
A 4-week diet low in fermentable carbohydrates can ease gut symptoms in IBD.
And blood pressure screening is nearly universal among Medicare enrollees.
Plus, why you need to temper osteoarthritis patients' enthusiasm for cannabinoids and for stem cell injections.
Wasteful spending in healthcare could reach almost $1 trillion with a T dollars, according to new research published in JAMA. The actual estimated tally of waste ranges from $760 billion to $935 billion. That's about a quarter of the nation's total healthcare spending. And potential savings from interventions to target waste run from $191 billion to $282 billion. Those are the calculations made by researchers at health insurer Humana, who reviewed the literature on healthcare waste and savings initiatives. They focused on waste in 6 areas: failure of care delivery, failure of care coordination, overtreatment or low-value care, pricing failure, fraud and abuse, and administrative complexity. Administrative complexity generated the most waste, accounting for $265 billion. Failure of care delivery, care coordination, and overtreatment or low-value care combined to generate another $200 billion in waste.
Statin use for a minimum of 3 months was significantly associated with a greater risk of skin and soft tissue infections. That's according to an analysis by researchers at Curtin University in Perth, Australia. They reviewed prescription claims from more than 228,000 people over a 10-year period. The study authors note that the literature on statins and SSTI or diabetes risk is conflicted. Some studies show reduced risk with statin use, others indicate ties to low-onset diabetes. The investigators found that statin use for as little as 91 days and for up to a year was linked with significantly elevated risk of SSTIs. Statins were also associated with a significantly increased risk of new-onset diabetes. That increased risk of infection was seen in patients who did and did not develop diabetes. Given these findings, the researchers say clinicians should monitor blood glucose levels in statin users who are predisposed to diabetes, and they should be aware of statin users' possible increased risk of skin and soft tissue infections. These data appear in the British Journal of Clinical Pharmacology.
A diet low in fermentable carbohydrates can reduce gut symptoms related to inflammatory bowel disease. Fermentable carbohydrates, or FODMAPs, occur in common foods including certain fruits, vegetables, and dairy products. They can draw increased water to the gut, and they can boost hydrogen in the colon via microbial fermentation. Research shows a low FODMAP diet can relieve gut symptoms in irritable bowel syndrome. But the diet has been little studied in inflammatory bowel disease patients. So, researchers at King's College London randomized 52 people with ulcerative colitis or Crohn's disease to 4 weeks on a low FODMAP diet or a control diet. At 4 weeks, 52% of patients on the low FODMAP diet reported adequate relief of gut symptoms, compared with 16% of controls. Patient-reported flatulence and bloating were also significantly lower in the treatment group. In addition, stool samples from low FODMAP patients showed significantly reduced abundance of 3 types of gut bacteria thought to have a role in immune response. The study appears in Gastroenterology. We'll be back with more medical news after this message.
Almost all of Medicare's 58 million enrollees had a blood pressure screening in 2017, and just under 90% saw a physician during that year. According to the latest edition of Medicare Beneficiaries at a Glance, 96% of enrollees were screened for high blood pressure, which is good because hypertension was the most common chronic condition among beneficiaries, prevalent among 58% of them. The report also shows that 41% of enrollees had high cholesterol in 2017, making it the next most common chronic condition. Arthritis took the third spot at 33%. Diabetes was fourth and heart disease was fifth, but rounding gives them the same prevalence of 27%.
Cannabinoids and stem cells may intrigue patients as potential treatments for osteoarthritis. But Dr. Joel Block of Rush University in Chicago cautions that evidence doesn't support their use, though planned clinical trials could clarify whether they actually benefit patients. Speaking at the annual Perspectives in Rheumatic Diseases held by Global Academy for Medical Education, Dr. Block said cannabinoid therapy is on everybody's mind, including patients. Cannabinoid receptors are widely present in all joint tissues, he notes, and endocannabinoids are clearly present in OA joint tissue. There's good evidence that the receptors regulate pain responses and central sensitization in a variety of OA animal models. But if you conduct a systematic review of all the randomized clinical trials of cannabinoids in human rheumatic diseases, you'll find a grand total of 4 studies. Dr. Block says only one of those studies is a randomized trial for OA, and it found no positive effect. He explains that clinical trials are still scarce as of now, so it's going to take a while before there's evidence for or against cannabinoids in OA. Intra-articular stem cell injections are widely offered in the United States and abroad. But do they work? Again, Dr. Block cautions that a systematic review in animals found that for all outcomes, the quality of the evidence was either low or very low. And in humans? He cautions that the results are the same. Systematic reviews of the evidence in humans have found that the data don't support the use of stem cell injections. Many clinical trials are planned, however, and Dr. Block predicts that, over the next several years, there should be some real data on whether stem cell injections are truly helpful or not. Global Academy for Medical Education and this news organization are owned by the same parent company. And that's it for today's Daily Medical News. Remember, you can find the Daily Medical News on Apple Podcasts, Spotify, Amazon Alexa, Pandora, and YouTube. For MD Edge, I'm Molly Collegio.
And I'm Nick Andrews. Thanks for listening to the Daily Medical News.